Well, good evening. On behalf of the 100 Black Men of America, we send our greetings. I'm Walter Kirkland. I'm going to be your moderator for today's event. What you measure is what you improve. We're kicking off a very intuitive plan called Healthcare 2.0. And we put together an esteemed panel of guests to talk about that. In the advent of COVID-19 and health disparities in Black America, we have put together a multi-year campaign. So I hope you sit back and enjoy it. There'll be a 4-part series. Today we launch it. Let's just do a little round robin here. And happy Vets Day, by the way. Dr. Alexandra, can you please do an introduction, Dr. Alexandra?
Thank you, Walter. My name is Mark Alexander. I am the national chairman, the national secretary for 100 Black Men of America. I am also the 100's chair for health and wellness, and I am a proud member of the Bay Area chapter.
Outstanding. Thank you, Dr. Alexander. Thank you for your leadership, too. Dr. Omar Danner, send greetings, please.
Yes, I am Dr. Omar Danner. I am a professor of surgery at the Morehouse School of Medicine, and I'm the chair for our Healthcare 2.0 initiative with the 100 Black Men of America. I'm a trauma and critical care specialist here in Atlanta, Georgia, and I'm also the chair for our COVID-19 Pandemic Action Group, and I'm excited to be here. Thank you, Walter. Yes, you're doing amazing work, sir. We appreciate you. Stanley Campbell, CEO of Eagle Force. What an introduction, sir.
Well, thank you, Walter, and thank you to the 100 Black Men and those 100 Black Men of America who are also veterans. My name is Stanley Campbell. I am the CEO and CTO of Eagle Force Associates and Eagle Force Health. You'll hear a lot more about Eagle Force. However, our connection with 100 Black Men is very fervent, and we look forward to supporting the Healthcare 2.0 initiatives for both healthcare and fitness.
Congratulations on your success. Zelda Johnson, can you say hello, Zelda?
Yes, thank you for inviting me to participate. Zelda Johnson from the Natural Hypertension Institute. I'm a doctoral candidate in natural medicine, specializing in integrative cardiovascular medicine, stress, and pain.
Welcome. Thank you so much. And Charles Latham, how you doing there, sir? Say hello.
Walt, I'm doing fine. And I thank you guys so very much for having me on tonight. My name is Charles Latham. I'm the immediate past president of the 100 Black Men of Grenada and a member of the 100 Black Men of America's Health and Wellness team.
Okay, we're going to bring in our chair. I think our chairman's available. We're going to bring Tommy Deutsch in. Thank you. There he is. Yeah. Mr. Deutsch, how are you, sir?
I am great. Good to hear all of you great folks on with us. And I want to just thank all of you first and thank all of our partners who've helped to make this day a reality. Yes. Healthcare 2.0 is phenomenal. And let me tell you, the health and wellness team, they sent me a little kit to make sure that the chair did his thing the right way. And so let me tell you, I'm on today speaking from true experience. This is phenomenal Healthcare 2.0. As we look at our challenges that we have with preconditions, we look at how we've been impacted by this COVID-19. But long before COVID-19, the Health and Wellness Committee and the 100 since 1994 has been focused on those issues that make a difference to us in terms of health disparities, working from our former Surgeon General, Dr. David Satcher, all the way through, and the phenomenal committee that we have of members who have stepped up. And so as we look at what we must do now and beyond this whole COVID-19, we have to have healthy communities. And so we encourage all of our members, all of those who are listening in, that without your health, nothing else matters. You can't look at wealth. You can't look at your professions. And so this is important. This is groundbreaking. And to be led by so many experts in the industry. And again, I want to thank all of those who are on the panel today. And as I look at the support we've had from Pfizer and all of the organizations who partner with us, we are going to win this battle in ensuring that in the African American community and in those communities that have been left out and left behind, that health is going to be number one, and we're going to do our part to build stronger and healthier communities. I had the opportunity for 10 years to chair the board of the authority that owns Grady Health System. I've seen it firsthand, what the needs are, the health disparities, but more importantly, when we address these issues, we can make a difference from our young people in their early childhood, looking at obesity, all the way up to what we see as what's been manifested as adult diseases. If we don't address them early, and even now, we test everywhere from our chapters at our national conferences, so we know how important this is. So let me thank again Dr. Mark Alexander, Dr. Omar Danner, but all of you on this panel and all of the folks who've been engaged and involved in this whole issue that got us to this day. So Healthcare 2.0, this is the launch. It's not the ending. It is the very beginning, and we're going to make a difference in the communities. And so with that, thank you for joining in, and we will continue this as a 365-day commitment that we must make in the 100 Black men of America.
Thank you. Thank you, Chairman Deutsch. Thank you for your leadership. You're an amazing leader. Thank you for those kind words. By the way,
Walter, thank you for what you've done too.
Oh, absolutely, sir. You know, for folks that want to put comments and questions, put that in the chat area. We'll bring it up in the Q&A. So let's get this thing cranking. We also have a guest on the line here. Before we get into the discussion, we have Brittany, is it Bethia?
Yes, Bethia.
Oh, I got it. Okay. She's Director of Communication Dissemination, National Center for Primary Care, Morehouse School of Medicine. And welcome. So you have a couple words. You're one of our new partners. Can you expel on your little presentation there?
Absolutely. Well, good evening to everyone. Again, my name is Brittany Bethia, and I'm the Director of the National COVID-19 Resiliency Network at Morehouse School of Medicine. The network is essentially a resource for communities, their families, themselves, and any one that they touch who has been impacted by COVID-19. We are essentially collaborating with community-based organizations who are on the ground in communities, understanding what the challenges are, to identify opportunities that we can address some of the disparities that our communities are experiencing. And so we're building this network now by engaging with organizations, and eventually we'll be engaging with individuals in the community to help us develop materials and messages, services that are all culturally competent. So we encourage everyone to visit our website at www.msm.edu/NCRN and subscribe for updates from the network so that you can be the first to know when there are new resources available to you in the area that you live in.
Well, thank you. And I know that we're going to be working with you. I'm actually one of the board advisors that will be working with you on a quarterly or monthly basis. So we want to say thank you for your partnership. And as you know, we're trying to make a difference in society. So thank you so much.
Thank you.
All right. Why don't we take this back to our national chair, Dr. Alexander. Do you have any opening statements as it relates to COVID-19 Healthcare 2.0 and the magnitude of what we're trying to do here, Dr. Alexander?
Thank you, Walter. And good evening to our audience and greetings from Oakland, California. Thank you for helping us launch Healthcare 2.0. Before we begin, I'd like to thank our partners and sponsors for their tremendous support of Healthcare 2.0. They are Eagle Force, the Council on Black Health, the National COVID-19 Resilience Network at the Morehouse School of Medicine, the Pfizer Foundation, and I would like to thank the members of our chapters that have pilot tested it, Healthcare 2.0. You will hear from one of those Vanguard members after the presentations. During this evening's webinar, you will learn about the components of Healthcare 2.0. You're going to hear a lot about persistent monitoring. It is a fundamental element of Healthcare 2.0. We are learning more each day about COVID-19, and you'll get an update on the transmission dynamics of the coronavirus and how, through persistent monitoring, Healthcare 2.0 can help healthcare providers offer a timely and more effective course of treatment for those infected with the virus. You will learn about the amazing technology and tools that Healthcare 2.0 uses to monitor our vital signs, fitness, and overall health. You'll get a sample of our health education curriculum, where today we will learn about blood pressure, one of the most important health risk factors for Black Americans. And finally, we'll get a sample of mindfulness techniques, natural immune enhancement strategies, and breathing methods that we use to complement medical therapy. We have allocated time after the presentation for questions. However, if your questions are not answered during this webinar, I invite you to email your questions to 100 Black Men of America's National Office, and our Health and Wellness Committee will respond to you. Enjoy this presentation.
Dr. Alexander, thank you for that great opening. We appreciate you. And as I indicated in the initial launch, this will be a 4-part series. Dr. Danner and his team will be extending additional modules and training and updates as it relates to Black health in America. So please stay tuned to these intuitive, engaging sessions. So what we're going to do now, we're going to pass it over to Dr. Danner. Dr. Danner is going to do an overview of COVID-19, viral sepsis, and it'll give you a good landing page of what this is all about. Dr. Danner? I think you're muted.
Yes, Walter. Again, I want to thank Radio 1 and Urban 1 for hosting us this evening. I want to thank Eagle Forest and Pfizer for their support in helping us to launch this very important initiative. It takes good partners to really make a difference. So first slide. But as we well know, COVID-19 has taken a significant toll on the Black community.
And 1 second, facilitator, can you put the slides up, please? There you go, thank you. And then put the banner when you get a chance. Thank you, facilitator.
Thank you so much. But as I was saying, that COVID-19 has taken a significant toll on the African American community. It has been associated with a lot of chronic diseases, and particularly things like hypertension and diabetes. What we'd like to do is use this as a time for us to come together to hit the reset button on the health of the Black community using this latest and greatest advancement in technology. Next slide. In today's presentation, what we'll do is we're going to have a quick update on the incidence of COVID-19. We're going to review this condition known as SARS due to COVID-19 or SARS pneumonia and explain why it is actually a form of viral-induced sepsis. And then we're going to discuss the importance of monitoring, persistent, continuous biometric monitoring, and creating your own personal digital health and immunization record, as well as elucidate the effects of COVID-19 induced stress on worsening your health conditions. And lastly, we're going to describe how Healthcare 2.0 will help us to eliminate health disparities and bring about health equity through self-management of chronic diseases and preventing exacerbations by using smart device applications and biosensor technology. Next slide. Then, and afterwards, we're going to transition and we're going to start focusing on one health condition, particularly that of high blood pressure or hypertension. We're going to review the International Society for Hypertension's guidelines and identify the risk factors associated with poorly controlled high blood pressure. A lot of people have misconceptions when they think about their blood pressure, whether it's controlled on a medication or a lot of medication, or they haven't measured it and not taking their medication. Is known as the silent killer for a reason. So we're going to describe proposed mechanisms for the development of hypertension and then identify opportunities for improvement in high blood pressure management using persistent biometric self-monitoring and remote physician management using telehealth applications. And then we're going to review a summary of the guidelines for hypertension, as well as discuss the importance of health literacy, lifestyle modification-oriented prevention to help us to reduce these risks of complications associated with chronic hypertension. Next slide. The first thing that I'd like to do, though, is again just a quick update. And currently, based on Monday's data, we've now crossed the 50 million mark of infected people with COVID-19 worldwide. There's over 1.29 million deaths in the world. And in the United States, next slide, there's now over 10 million deaths in the United States, with over 237,000 deaths in America. When you count numbers that may not be as obvious as it relates to COVID-19 deaths, these numbers now exceed 250,000 and arguably are now approaching 300,000. In states around the country, the numbers are going up significantly, and we don't have anything right now that's slowing it down. Vaccines are starting to come online, but they're not readily available, and there's no acute therapy or treatment for this condition. So we're still trying to bring this virus under control. Next slide. So what we would like to do is really kind of talk about this and bring this into perspective, because we've heard about this term health disparities. But what this means is that there's one group that's affected differently than other groups. With COVID-19, there was initial myths and misunderstandings that it doesn't affect Black people were immune. Well, this is far from true. In fact, Black people, African Americans, have a higher rate of infection, and then they have a higher risk of a bad outcome. When we look at Black Americans or Black people in general compared to other racial ethnic groups, Asians, Hispanics or Latinx or Latino groups, or Caucasian Americans, African Americans or Black people in the world have a 2.65 times higher likelihood of death due to the same virus, with all other conditions being equal per 100,000. Next slide. The question is, why? Well, we know that, again, this is a viral infection, but what tends to happen is there's a association with underlying health conditions which tend to be more prevalent, as Mr. Deutsch elucidated, in the African American community. So one of the things that we can do is starting to learn or understand what are the risk factors, identifying the symptoms early. And then what I want to do is talk about how these symptoms, when they start developing and worsening, advance to a condition known as SARS as well as sepsis. But initially, COVID-19 presents with mild symptoms. Some people say asymptomatic, but they're just mild and non-specific. Any symptom makes you symptomatic. And so what are some of those symptoms, such as fever, fatigue or tiredness, dry cough, runny nose, sore or scratchy throat, muscle aches, muscle pains, burning in your nose, diarrhea, and next slide, keep going forward, please, as well as a loss of smell or taste. As this progresses to more significant or more severe symptoms, such as high fever or temperatures greater than 100.4 if you measure it, this becomes a sign of more invasive and more significant disease. When you start developing respiratory abnormalities, such as shortness of breath or a severe cough, or if you have neurologic complications such as new confusions or inability to wake somebody up or arouse them, this is evidence of neurologic or brain dysfunction. When you have bluish lips or bluish face, we call this cyanosis. This is a sign of respiratory failure when your oxygenation is so low that you no longer have that reddish pinkish hue. This is a significant condition and is a sign that your lungs are failing. But you should also have to objectify this by measuring your temperature. A temperature, again, of 100.4 degrees Fahrenheit or 38 degrees Celsius is considered to be a risk factor for worsening sepsis or infection. It could be due to bacteria, it could be to a fungus, a protozoan, but it can be also due to a virus. So a temperature in and of itself doesn't mean you have a viral infection of COVID-19, but it's one of those risk markers that you have to be aware of. When you have this, in the context of decreased oxygen in your blood, this represents that you have worsening of your condition or one organ dysfunction, respiratory dysfunction. And this becomes important as we start thinking about this condition called SARS. So severe acute respiratory syndrome is a condition in which your lungs, your respiratory system is starting to fail, and your oxygen in your blood is less than 60 millimeters of mercury, or your saturation starts falling less than 90 to 92%. When this presents in the context of low blood pressure, this is another sign of circulatory or cardiovascular dysfunction and shows that the body is starting to shut down in response to this infection. The thing is, it doesn't start off this way, but it can progress. This is a progressive condition. And ultimately, we're going to talk about a condition known as sepsis. But this period before a person has obvious symptoms or it becomes SARS, there's this period of about 2 to about 14 days from exposure in which someone may have mild or no symptoms. But as it progresses, the condition becomes more severe. So early detection becomes very important and vital. Next slide. In detecting this condition that we may initially think of as SARS, but it doesn't make a lot of sense because, again, it's just a foreign word to many of us. But what the severe acute respiratory syndrome is a condition in which your body has an invasive infection with respiratory failure. I want to talk about this in terms of viral sepsis or sepsis in general. Sepsis is a systemic inflammatory condition caused by an invasive infectious condition. This can be a viral condition. It can be a bacterial condition. When it's due to a viral condition, it's still sepsis if you meet certain criteria. So what are those criteria? These are things that you can measure, particularly with monitoring devices. This right here is a digital thermometer. It's as simple as a push of a button. There are other things such as pulse oximeters that you can monitor your heart rate and your saturations. But it's important to understand that when you have 2 positive SIRS criteria, then you actually meet the criteria for what's called the systemic inflammatory response. When you have this plus the presence or the suspicion of an infection, you have what is called early sepsis. When you have organ dysfunction, we call that severe sepsis by what's called the O or sepsis 2 criteria. By the 3rd consensus conference criteria, when you have organ dysfunction, you now have a condition known as sepsis. And I'll talk a little bit more about this. But what are these inflammatory response criteria, are these numbers that you need to know and put in perspective? When your heart rate's over 90 and particularly over 100, this represents signs of systemic invasive infection or abnormalities. Respiratory rates greater than 20 or 22 are associated with increased respiratory dysfunction. If you're in the hospital and you see somebody with a carbon dioxide less than 32, this suggests respiratory dysfunction, as well as a temperature that's less than 96.8 or 36 or greater than 100.3. This actually represents another SIRS criteria. And lastly, if you're in the hospital and you have labs drawn, and with viruses, they tend to be less than 4,000 for viruses or greater than 12,000 or greater than 10% premature cells, which we call a bandemia. This represents a form of invasive, particularly potential infection. When you put this in context, next slide, and you have organ dysfunction, sepsis is not just one condition, it's a spectrum, and it ranges from a mild invasive infection to severe sepsis with low blood pressure. And this, when you have low blood pressure, is what we call septic shock. But severe sepsis can be caused by COVID-19. And when you have 1 or 2 organs that are dysfunctional, such as, say, for instance, you have a low saturation and your kidneys are shutting down or you're having liver dysfunction, this is called severe sepsis. It's severe viral sepsis. And so, again, not just SARS or severe acute respiratory syndrome. This is an invasive infection that's affecting the brain, altered mental status, your kidneys, your liver, and your other system, your clotting system. That's why some people are having clots and actually even having complications up to death from this. When you have low blood pressure that does respond to fluids and your blood pressure is less than the top number, systolic less than 90, or your bottom number or your actually we call the mean arterial pressure less than 65, we consider this to be septic shock. When you have multiple organs that fail, this is a sign of advancement of disease, and this becomes very critical in that this is the next thing after this is death. And that's why a lot of people who have COVID are dying. This is not a condition where you go home and wait in place. If your body is starting to develop this, you need to present to medical care. Next slide. And so the treatment of sepsis, whether it's viral or bacteria, some basic things, early and accurate diagnosis. Once you have that diagnosis, there's something called early field triage stratification, and basically being directed to the right place by your medical providers is a critical part of the care for the sepsis on a local, regional, and national basis. Treatment and correction of identifiable causes is important because there's some conditions like the flu or bacterial pneumonia, which may be present, that we can treat with Tamiflu or Xofluza for the influenza A or B virus, but particularly influenza A, or for bacterial pneumonia such as a strep or pneumococcus pneumonia that you could treat with the zithromycin or some other antibiotic. But restoring blood pressure, restoring optimal perfusion, improving your oxygen, even if it's by supplemental oxygen. Sometimes you may even need a ventilator, not waiting till your saturation are less than 80%, or you're having severe strain on your heart is very important. So restoring your numbers back to normal or above normal is critical in the early stages to prevent the consequences of this severe viral condition. But optimizing your immune system's ability to fight off infection and turn off inflammation through immune enhancement or immune augmentation using what we call our immune enhancement strategy, which includes things like vitamin D and zinc and things that you've heard about, vitamin C and multivitamin, becomes very critical. Next slide. So as we continue to look at this, one of the things we've got to really put into perspective, who is at increased risk for COVID-19 induced sepsis and poor outcomes due to worsening chronic conditions? People with high blood pressure, diabetes, heart disease, cancer, chronic lung disease such as emphysema or chronic bronchitis or asthma, people on immunosuppression medication requirements due to prior organ transplant such as kidney and liver transplant, people who are smokers. Next slide. People who have histories of things like end-stage renal disease, renal failure, on dialysis, whether at home or going to the center. This puts you at increased risk. People who have had previous strokes and may have some disability. People who are morbidly obese. People who have depression and anxiety and other mental health conditions such as psychosis or schizophrenia or Alzheimer's are at increased risk because they may not present readily for medical care due to their mental health condition. All these things have to be detected and monitored. But in the end, there's, just to bring it up to date, up to speed, there's no effective FDA-approved treatment. There are some that we are trying, like remdesivir and Regeneron, that doesn't really have true proven efficacy in the early stages. When you're very sick and in the hospital, and now we're fighting off sepsis, there's things like that and some anti-cytokine meds that may have some efficacy, but now you've progressed too far. We're talking about in that stage when you can actually really make a difference. So what are some of the things that we can do? One of the things we can do is prevention. And this is where vaccines come in when they are available. There's been some promising stuff in the media. Pfizer's vaccine is shown early on about a 90% efficacy. And some of the other ones are actually starting to show, again, similar efficacy in the early results of the trials. But for widespread public consumption, they probably will not be available until sometime toward the early part of the year or maybe into the spring, according to the recent data. So what can we do? We can prevent this condition by following the guideline, wearing masks, practicing social distancing, good hand hygiene, but prevention remains the most effective strategy, and optimizing your immune health using high dose vitamin D to normalize your vitamin D levels to greater than 40. This usually takes a loading dose of 50,000 units and then 10,000 units a day. Some doctors will put you on 50,000 units per week of vitamin D3. This is the animal form that has the greatest efficacy inside the body. But vitamin D supplementation in combination with zinc supplementation, if you don't have an infection, 50 milligrams a day. If you do have an infection, 100 milligrams to 150 milligrams a day, or 50 milligrams 2 to 3 times a day may slow down the viral replication. There are studies by Dr. Robb out of Colorado Health that actually shows this, that it has some association. But this in combination with things like multivitamins, which have a lot of B vitamins and C vitamins, which improve cellular health, along with natural antioxidants such as turmeric or elderberry that has anti-inflammatory and antioxidant effects, may actually help protect your body against some of the inflammatory mediators and the oxidative stress due to this coronavirus infection. But in the end, you have to be able to monitor yourself and your condition and watch for progression. What Healthcare 2.0 is about bringing these things together and then starting to self-monitor continuously, day to day. If you have a condition that needs warranting or warrants monitoring multiple times a day, then doing it 2 or 3 times a day, and beginning this concept of self-management of your chronic personal health. This requires you getting in touch with your personal health record and working with your physician using this emerging technology as we basically fight off this COVID-19 and chronic disease. This is a COVID-19 and chronic disease surveillance program, which will help us to manage through this crisis. Next slide. This can be done with the use of technology such as your own smartphone devices. 4G and 5G smartphones can couple to this platform that we're going to introduce to you called MimiRx. And this technology can be coupled with smart devices, next slide, such as blood pressure monitoring, saturation monitoring. This right here is a thermometer which will allow for us to measure our own temperatures. This device is Bluetooth enabled. It doesn't have to be a Bluetooth enabled sensor. It can be actually added into the device manually, or it can be done automatically. But this device, along with a pulse oximeter, which is an oxygen saturation monitor, not only allows for us to monitor our heart rate, our saturation, it also allows for us to monitor our heart rate. This, along with, next slide, monitoring of our blood pressure, it really brings the vitals that we get measured at the doctor home. And when we have this data measured day to day as a continuous information stream, except instead of episodically at the doctor's office, it gives us incredible ability to use this information to help guide and navigate health. So in conclusion, with widespread adoption of portable electronic biometric sensor devices and this persistent self-monitoring technology within our community and throughout the nation, Healthcare 2.0 will help us to reestablish the health and well-being of our community by preventing exacerbation of chronic health problems in America. Electronic documentation of your clinical symptoms through the symptom monitor in this application that we're going to share, tracking your baseline vitals daily, optimizing nutrition and fitness and immunity, and identifying changes in your condition early are invaluable ways for you to help your doctor help you. This is right. Help your doctor help you. This is not to operate outside of the healthcare community. This is to partner with them, but you need to be an engaged participant. So establishing a baseline for our biometric data, such as our vitals, will be helpful for older adults, our parents, those who may be at risk in nursing home or at home with pre-existing conditions. This is going to be very important. But groups of people who have no choice but to be in close contact, such as families with small children, have to have the ability to monitor this outside of the healthcare system. So you must know what your health numbers are, but more important, know what they mean and know what you can do about them. So this technology also allows you to screen and manage your younger and older adults or family members with acute respiratory diseases or infectious diseases, such as viral outbreaks during this COVID-19 pandemic. As we're about to go into this next respiratory or flu season, as we typically call it, we have to be able to self-monitor. So that being said, what I'd like to do is, again, just help you to understand, or ask you to understand, that this is putting a significant toll on us and our communities. and this technology is going to help us to navigate through this. We're going to have Mr. Stanley Campbell to speak to us a little bit about this concept of self-monitoring, and then we're also going to talk, Zelda is going to talk to us about how COVID-induced stress is really taking its toll and tell us some things that we can do to help get rid of this.
Great. Thank you, Dr. Danner. Very informative session. Learned a lot. You're amazing. And this is just a great baseline of discussion. So I want to tee this up. Mr. Campbell is going to give us a nice little overview of this thing called MimiRx and Eagle Force. And it was an amazing press conference. Mr. Campbell, can you share with that press conference? And that was pretty amazing what you guys did there.
Well, thank you, Walter, and thanks, Dr. Danner and Chairman for all the great work that you guys are doing. At Eagle Force, we are just so overwhelmingly proud to be participating with 100 Black men as it relates to Healthcare 2.0. So ours is a national cause that when you've got technical capabilities, and we know the issues associated with 21st century cures, we're moving into a 5G world. We are in a 5G world. And what COVID did is it actually presented us with a clear indication of the fact that we have health disparities that are overwhelmingly focused at Black and brown people. And I would even say Native Americans as well. And based on that, and as well, through my own personal experiences, I could not sit on the sidelines and without being able to actually get engaged. And what we did was we got engaged with MimiRx, which is the core competency of the technology. We're bringing sensors to the table, and as Dr. Danner talked about the sensors, if I am poor or I don't have a smart device, I actually don't have access to healthcare. So we also empower those individuals with the tools, technologies, and capabilities such that they can compete and complete their own self-monitoring of disease within this 21st century 5G world. So with that, would you please roll the video, and you'll see how we're also partnering with 100 Black Men and Dr. Danner with the city of
The City of Miami is collaborating with MyVax. We are highlighting the fact that MyVax is now available to be downloaded for free by people to have all their electronic medical records available to them. And they are also working alongside those Miami residents with their insurance to distribute 50,000 phones with the app, which will have essentially 2 years of service that will be paid for by that program. We live in a world where our healthcare records have never been more important. We obviously know what's ahead of us in terms of what this country needs to do to get through COVID. And one of the big things that we're going to have to do is something we've never done in our history, which is vaccinate potentially the entire population of the United States.
Using MyVax can help allay these fears because it empowers people to work with their healthcare providers and help monitor their own care.
What it's doing is giving people who not only don't have access to technology into their history, but those who don't understand the necessity of having such perfect information to give to your doctors to make decisions about your life. And we're going to do all that we can to ensure that people have the access to quality healthcare that they need right here for the residents of the city of Miami.
Wow, that was pretty amazing. Thank you, Mr. Campbell. That must be pretty exciting in that state of Florida in terms of the proliferation of Healthcare 2.0 and the vaccination of MimiRx. I mean, that must make you feel good in terms of moving forward and getting a standard registry.
Well, MimiRx is actually the parent of my. That's for all of you on the Healthcare 2.0. You actually have the as it relates to Healthcare 2.0. MyVax is just a subset that is particularly focused at COVID-19. But as we talk about persistent monitoring, one of the biggest things that we kind of miss, because obviously we're in the midst of a pandemic and it's only getting worse, but fitness actually becomes one of those things that a lot of us already monitor. If I have Fitbit, if I have an Apple Watch or a Samsung device, I'm already doing my pedometry. I'm already compete every day with my wife and medical officer, and even Walter, because know their numbers and then broadcast out their numbers. But if we look at fitness and we look at the persistent monitoring on these devices, this actually can be fun. When we first started with seat belts, and we understood the safety and the efficacy of seat belts, we actually were uncomfortable. We would even cheat and get tickets. Now you get into a car, you're uncomfortable if you don't put on the seatbelt. The car yells at you. And so where we are right now with this transitional transformation to 21st century healthcare and 21st century cures, we should not forget that as we enter the 5G world, health, fitness, diet, and all those things that we find that have historically brought us health disparities, we will bridge the gap. We will bridge the gap, and we will do it on a person-by-person basis where 21st century cures is available to everybody and not just to those few who have Cadillac insurance plans and who can actually afford devices which are designed to bridge these gaps. So thank you all. Thanks to 100 Black Men. Thank you all for all that you're doing, because you are truly making a difference.
Stanley, thank you for your commitment. Thank you for your technology and your experience. And we want to say thank you. Now we're going to move on to another presentation. Zelda Johnson's going to give us a presentation about stress and wellness. Zelda, are you ready to go?
Yes. Before we talk about stress management, after all that information, I want to offer some resources for you. May I have the PowerPoint, please?
Yes. Facilitator, there we go. All right.
Actually, it would be the one managing your emotions. That's Eagle Force. Well, there we are. Thank you so much. There are a couple of resources we want to recommend for you when things get just too heavy. The Substance Abuse and Mental Health Services Administration provides treatment resources in your locality for following needs like substance, alcohol, and drug abuse, serious mental illness, suicide prevention, and disaster distress. You can call SAMHSA's National Helpline at 1-800-662-4357 or the National Suicide Prevention Network at 800-273-8255. Next, we have the Columbia Lighthouse Project. They seek to train individuals, community organizations, and healthcare facilities to identify and assess the risk of suicide in adolescents and adults. And Taraji Henson established the Boris Henson Foundation. Her father suffered from mental illness, and she acknowledges the anguish of mental illness in COVID-19. They're offering free COVID-19 virtual therapy campaign, seeking to provide a therapist for anyone with presenting symptoms of anxiety, suffering from the death of a loved one, lack of supplies and resources, depression, or other serious mental illnesses. I definitely suggest you take a look at the BorisHensonFoundation.org for these free virtual sessions. And in every state, simply by calling 211, you can get assistance for any of the symptoms that I talked about or any type of concerns. It covers all 50 states, including the District of Columbia and Puerto Rico. You can call 211 on your phone or go to the website 211.org. Next. The Columbia Protocol is a protocol that provides also services for friends and neighbors. I wanted to make sure you got that information because they are an excellent project. 7 Elements of Calm is what I recommend as a holistic way of looking at managing your stress. You want to take a look at facts, You want to make sure that you are looking at making connections with family. Take time out with friends, loved ones, and you want to set up some type of area where you can go that makes you feel comfortable. I like it as a sacred, safe place. Your bedroom, your kitchen, your dining room. You want to set some type of routine for yourself. In the morning, you want to have a routine. You want a routine for eating. You want to be able to take a break, time for work, time for talking with others, etc. You want to do what makes you feel good. You should always know, what do I want to do when I need to feel up, lift up my spirit? I like the movies. So there's movies, there's the internet, surf the internet for a little while, etc. Whatever makes your world feel good. And take a pause, tap into your senses, and be able to establish calm. I'll tell you about a few other tools you can use for that as well. Next. Now, one of the most important things about managing your stress, especially in this time of COVID, is managing fear. Fear is a very strong emotion, and fear carries with it the ability to change your frequency. We're energetic beings. So if you have serious fear, it changes your brain chemistry, changes your frequency. When that frequency changes your brain chemistry changes your blood chemistry to acidic. And acidic blood chemistry makes you more predisposed to disease, including COVID-19. It's important to stay positive and not stay in fear. Next slide. We'll talk about hypertension in reference to stress management in the next segment. Walter?
Excellent. Okay, so why don't we take this back to Dr. Danner? Thank you. That was a very informative session, Dr. Danner. We're going to take you back. Okay, there he is.
All right. So again, I want to thank Zelda for really kind of talking about stress and some things we can do, because when people are under stress, in addition to the other reasons for blood pressure being elevated, stress can exacerbate this chronic health condition. So what we want to do in this next segment is really kind of talk a little more in depthly about hypertension or high blood pressure. And so the International Society for Hypertension released their global recommendations on the management of hypertension in adults aged 18 years and older in June of 2020. We're going to discuss those guidelines and, where possible, the International Society for Hypertension differentiated between optimal care, evidence-based standard of care, and then essential care. What's the minimum standards of care in low resource settings? And so we're going to also talk about selected recommendations, which, again, it's important to know that if you have high blood pressure, particularly in Black America, you're 40% more likely to have a bad outcome related to high blood pressure. In addition, you're 10% less likely to be treated, and you actually are three times more likely to have a worse outcome compared to age match, gender match members of, say, for instance, the Caucasian community. So high blood pressure is a significant problem, and we tend to have a worse outcome in African Americans, and particularly Black and brown people, as we would like to say. Next slide. So I'm going to talk pretty fast in this next segment just to kind of hit some highlights, but hypertension is classified according to your blood pressure, your systolic, your top number, and your diastolic, your bottom number. What we want is not that you just know what these numbers are, but what you know what they mean. And so the top number, as I said, is called the systolic blood pressure. A systolic blood pressure, a top number less than 130 or less than 85 on the bottom number, which we call the diastolic blood pressure, is what we consider normal. So this sets the baseline. If it's above this, if your blood pressure is 130 to 139, this is considered to be high normal or elevated blood pressure. And if it's 85 to 89, it's considered to be elevated or high as well. But when you start getting blood pressures that are consistently over 140 in the top number, systolic or greater than 90 in the bottom number, this is when you develop what's called stage 1 hypertension, which is a clinical medical diagnosis. There are 3 stages to hypertension in general. Stage 1 is a systolic blood pressure of 140 to 149 and a diastolic of 90 to 99. Stage 2 hypertension is a systolic or top number greater than 160 up to 179. And you can keep, next slide is fine. But when you have a blood pressure that's over 160 and less than 179 is stage 2, and when it's over 180, this is considered to be stage 3 hypertension. If you have elevation in the top number, your systolic blood pressure, without elevation in your diastolic blood pressure, diastolic blood pressure less than 90, you can have what's called isolated systolic hypertension, and it follows the same stages with the same risk of damaging your heart. Or if your diastolic, the bottom number is high, it leads to conditions which put you at higher risk of developing kidney disease and strokes. And so this all actually is something that happens very quietly while your blood pressure is elevated. And this is why we call it the silent killer. Next slide. So when we think about classifying these conditions, we have to understand that there are different settings in which blood pressure can be numbered or measured. In the office setting, ambulatory is like, say, for instance, at a CVS or Walgreens, or home-based measurements, such as using these automated blood pressure cuffs, which now are readily available through iHealth or at Amazon.com, Walmart, or Walgreens. These devices can be purchased, and these are things that now, coupled with the smart device technology, gives you the ability to self-monitor and self-manage. But an office blood pressure greater than 140 or a diastolic greater than 90 is considered to be high. Ambulatory blood pressure, 24-hour average greater than 130, say for instance you showed up at the blood pressure drive at CVS or at a health fair, or a diastolic greater than 80 is considered to be high, and it should be rechecked. If it's greater than 135 in the daytime or greater than 85, this is considered to be high, as well as at night, you should be under less stress. Your blood pressure should go down. So if your systolic is greater than 120 or your bottom number is greater than 70, this represents increased risk of developing or having hypertension, and this should be rechecked as well. So if you have a home-based blood pressure monitor and you check it and it's greater than 135 on the top number or greater than 85 on the diastolic or bottom number, this is hypertension or at risk for hypertension, and it should be medically evaluated. Next slide. So as we continue to start looking at this from the standpoint of, next slide, please, of risk factors, when your blood pressure is elevated and you have other health conditions, pre-existing health conditions, things like diabetes or obesity from an unhealthy diet, high sodium and high fat diets, physical inactivity, too much alcohol, too much tobacco, or you have genetics which predispose for atherosclerotic or cardiovascular disease, you have a strong family history, this places you at increased risk. Stress places you at increased risk. So it's important because these are higher, more prevalent in the Black community and in other vulnerable communities, Native American, Hispanics, and other vulnerable populations that may have pre-existing health conditions. So it's very important that you know that this technology is readily available. This right here is one form of the iHealth blood pressure cuff. It's called the iHealth Clear Wireless Blood Pressure Monitor. But there are other ones that may be simpler and easier to use. Next slide. This right here is the iHealth Field Wireless Monitor. Regardless of whether you measure this digitally and using infrared or Bluetooth technology or measuring it manually, it's important that you measure your blood pressure and you check it on a regular basis. And we're going to talk about the importance of this at the end. Next slide. In addition, you should also keep track of your blood sugar and things like, this is called a glucometer. This is the iHealth Smart wireless glucose monitoring system. This allows for you to monitor your blood glucose at home digitally and record it on a smart device using this Mimi RX or MyVax type platform. This allows you to keep your health records all in one place and tie it to your chronic or your long-term medical record. In addition, if you're overweight or obese, or you have a high BMI with a high, you say your waistline in a male greater than 40, female greater than 35, this puts you at increased risk for central metabolic syndrome, and this places you at increased risk of heart attacks and strokes and conditions like that. If your BMI is elevated over 30, it's considered to be obesity. That's greater than, like in a 5'4" person, greater than 150 pounds. You should be monitoring your weight with a scale on a regular basis, at least checking it every morning and at the longest once a week to keep track of this. Next slide. So as you continue to do this on a regular basis, as Mr. Campbell said, this should be as easy as putting on a seatbelt. This should become just common practice. Next slide. We want to get to a point where we're monitoring and reporting to our doctors, because when we put all these things together, increased abdominal girth, as I told someone yesterday or the other day, that there's no such thing as being big bone. When your BMI is elevated, it's increased risk of developing cardiovascular disease due to this central metabolic syndrome. So increased abdominal adiposity, in addition to a triglyceride level in your serum greater than 150, or a cholesterol level greater than 200, or a low, what's called HDL is your good cholesterol. Less than 40 in a man is considered to be bad, and less than 50 in a woman. It puts you at increased risk of developing heart disease. But this, combined with high blood pressure, systolic greater than or equal to 130, or diastolic greater than or equal to 85, puts you at increased risk of developing diabetes and the complications associated with this. If you have elevated fasting blood sugar greater than 110, this is also a sign of actually the central metabolic syndrome, which is also called insulin resistance. And this is the forerunner to the cardiovascular disease that lead to heart attacks and strokes, which is in heart attacks and cardiovascular disease is the #1 killer, but it also puts you at increased risk for developing cancer and other conditions like this due to chronic metabolic conditions. Next slide. So again, know your numbers. Measure your numbers, and once you know your numbers, if they're outside of the normal parameters, we need to start thinking about what are the things we can do to get these numbers back in alignment, back down to normal. A BMI that's really less than 25, or a blood sugar that's less than 110, or a blood pressure that's less than 120 over 80. So, again, with this, at the first office visit, if you concurrently, when you talk about measuring blood pressure and knowing whether or not you have hypertension, if you measure your blood pressure and there's greater than a 10-point difference, this is abnormal. If it's less than 10 points, then there's nothing to do. But if it's greater than 10 points, say it's 130 in this arm and 120 in this arm, you take the blood pressure in the highest arm. If you have a blood pressure top number that's greater than 20 points, greater than 20 millimeters of mercury different, this is actually considered to be abnormality. You still use the highest number to diagnose whether or not you have hypertension, but it may suggest an underlying health condition, such as a stricture or narrowing in the big blood vessel of the aorta called a coarctation, and this is something that needs increased medical attention. If your office blood pressure is less than 130 over 85, you should remeasure this at home and make sure that it's checked again in your at your annual visit. But don't just ignore these numbers. When they start approaching these numbers, you're at increased risk. So higher monitoring is very vital. Next slide. And so when the office blood pressure is over 130 to 159 or 85 to 99, you need to confirm that these are really abnormal by getting repeat measures. If on these repeat measures they stay elevated, these are indications for treatment. A lot of times treatment can be non-pharmacologic with diet, exercise, and these type of modifications. But if this does not correct this condition, then you may need other more aggressive therapies. If your office blood pressure at the doctor's office is greater than 160 and greater than 100, it should be reconfirmed in a few days. And if it's elevated on that repeat measure, then you should probably be on some form of therapy that we'll talk about in a second. So what are some ways that we treat high blood pressure? There are, for African Americans, most of the time, next slide, we start off with something called a thiazide diuretic. But before we do that and start medication, usually we have to evaluate the patient to see what's going on. I say this because I want you to not just let them evaluate you. I want you to understand what those labs are. Look in my chart, look in your medical record, but what's your sodium level? What's your potassium level? What's your creatinine? This measures your kidney function. What's your fasting glucose level? What's your glomerular filtration rate? It should be greater than 60. Look at your lipid profile. And on the urine dipstick, what is this? What do these numbers mean? What are you looking for? High protein. Protein shouldn't be in the urine. When it is, it's showing signs of kidney damage. They should get a baseline EKG to make sure you don't have any underlying heart disease, such as atrial fibrillation, the left ventricular hypertrophy, or ischemic heart disease. But other tests can be ordered as needed to evaluate you for hypertension, such as a retinal scan. Next slide. So what are the steps to managing elevated blood pressure? Well, the first thing is knowing your numbers, making sure that you get it checked regularly, manage your diabetes, take your medication as directed, and make healthy lifestyle changes. Next slide. And so I'm going to talk just real quickly about some pharmacologic treatments just in general. So if you do have high blood pressure, usually the first line of treatment is a thiazide diuretic. This has shown efficacy in African Americans, and it helps to prevent the progression of some of the complications related to it. Next slide. Other agents such as potassium sparing diuretics are actually showing some efficacy in treating high blood pressure in African Americans and show some protection against the hardened development of kidney disease. Other agents such as loop diuretics and beta blockers are not as efficacious in African Americans. Next slide. But there are other agents such as angiotensin converting enzymes that basically block one of the hormones from the kidney that actually elevates the blood pressure. And this shows some protection. But calcium channel blockers, there's some evidence of efficacy in African Americans. So things like Norvasc and amlodipine, but ACE inhibitors actually tend to work better in African Americans. So next slide. So when we think about, high blood pressure, what we want to do is know our numbers, know what they mean, know when we're at increased risk, such as 130 to 139 or 85 to 90. When you start going over 90 or over 140, this is stage 1 hypertension. If you're taking your medication and your blood pressure is normal and controlled, it does not mean that you don't have hypertension. It means that your numbers are controlled, your blood pressure is controlled, you have a treated medical condition. So if you have this, you need to begin a program of persistent self-monitoring using a platform such as MimiRx as a part of our Healthcare 2.0 initiative. What we need and what we want you to do is to join us in our fight against these chronic health disparities by enrolling in MimiRx today. Next slide. So what are the benefits of persistent monitoring? It puts you in the driver's seat. It puts you in control of your own health. Persistent self-monitoring, along with your physician or provider's guidance, allows for efficient utilization of the healthcare system resources and ordering of the appropriate diagnostic tests for the management of high blood pressure and other health conditions. It also facilitates earlier identification and treatment of worsening high blood pressure and other things like diabetes and heart disease. Next slide. So in conclusion, prevention of hypertension is the best treatment of all. But prevention of hypertension is associated complications due to progression, such as stroke and other cardiovascular complications, such as heart attacks and congestive heart failure, is possible and is an important part of Healthcare 2.0. Our digital telehealth solution provides us with the tools we need for personal health monitoring and remote clinical management to overcome the traditional barriers to access to health care and health success. And it also will help us to increase our risk, or increase basically, or prevent basically our increased risk due to modifiable risk factors such as obesity, poor diet, physical inactivity. These are important to know and basically monitor so that we don't have these unfortunate outcomes that we've been seeing during this pandemic. Next slide. So what I'd like to do now is just for a second, just in closing, just really reiterate, it's very important that you embrace this new technology, embrace this initiative. Healthcare 2.0 will provide you with the ability to continuously self-monitor your vitals and work with your healthcare provider to facilitate appropriate screening and testing for hypertension and other health conditions. It'll enhance access to care because this system can be linked to your provider. Your doctor can join in and sign on and participate and use this technology, which is readily available to help you in your monitoring. And it can help you manage other clinical conditions, even depression, through programs like Pearls. It can also help you to control your blood pressure, your blood sugar, and ultimately save lives. So in the end, seeking health improvement education and implementing healthy lifestyle changes such as eating a well-balanced diet, participating in regular exercise, practicing stress reduction, and getting proper rest are vital to your success. And what we want to do is be able to provide you with those tools and resources to support you in your condition and give you more information over time. As Walter said, we're going to have additional virtual town halls, and we're going to talk about things like diet and nutrition. We talk about obesity and diabetes more in depthly, cardiovascular disease, as well as cholesterol. And we're going to help empower our people in our country and in our world to basically take better care of themselves. And so before I leave and transition, or before we leave, I'd like also for Zelda, who's an expert in the treatment, natural treatment of hypertension, to come on and just give you a few more tips. So Zelda, what are some things that they can do today to start taking care of themselves and improve their blood pressure?
Well, that's a good question. Thank you, Dr. Dana. That was an excellent presentation of clinical factors of hypertension. I'd like to talk about the other side of hypertension, which is the continuation of looking at stress as an etiology of hypertension. So I'd like for this to be kind of an exercise for everyone that's listening. How do you manage the big items that affect your emotions? And tell me, what do you think are, let's say, the number 3 things that get you upset that you notice it elevates your blood pressure? And I'll give you 30 seconds.
Next slide, please.
Oh, I don't need the PowerPoint for the moment. I just want to get the participants to start to think about all that information that you gave them, along with seeing how perfectly the devices that you have developed help them see how they can measure their blood pressure after understanding how to manage their stress. You can see the difference in the numbers going down in both your pulse, your blood pressure, and then an increase of oxygen. So if you thought of finances as number 1 is a problem that really gets your blood pressure elevated, you would be right. The second is relationships or disappointed love, family, work, time management, being able to juggle everything. Of course, your health, real or perceived, worrying about it. And then environmental, your surroundings. Many people don't live in safe neighborhoods. That contributes to stress. If we think about some other things you need to do is stop worrying. Give yourself a break. Stop worrying and stop digging up graves. You ever find yourself with someone who talks about the same thing over and over and over? You wonder what that's doing to their body and their mind, and certainly their blood pressure. Identify productive and unproductive worry. So you talk about something constantly. Get out a journal, write down all the things about it, think about ways to resolve that problem, and let it go. Then you can find your blood pressure can begin to come down. You're moving with accepting reality and committing to the influence, not to change the situation, but thinking positively can influence the outcome. This is also called manifesting. Manifesting comes from hope and your efforts. Remember, I talked about staying as positive as possible versus negative feelings of fear. Change requires you to try to manage too many items within the situation. That's why I say manifestation. Manifestation says, I'm going to influence what I can change. The other thing is to stop worrying, is challenge your worry thinking. Is this really important? What parts of the situation can I influence? Again, what's the worst and optimal scenario? How about you flip the script? That's my favorite saying to my clients. Does it always have to be a bad thing? And next, focus on the deeper threat. Is worrying about the situation worth my health? Don't take every confrontation as yours to take. That's what Idris Elba said. I think that's very important. Turn failure into opportunity. That is one of the top 5 things I'm telling all clients that come in to talk about, oh my gosh, COVID is really taking a toll on me. I'm worried about this and that. And it's healthy to worry about what's real. But make lemonade out of lemons. Always look for the opportunity in any situation, even if it's just personal growth. I ask everyone to put together a goal statement, what you'd like to see at the end of this pandemic. Go to school, take free classes. There are a lot of free classes that are available for you. I had one client who said, you told me to make lemon out of lemonades, and it's a bad situation in the economy, etc. I went to my car dealer and asked if I could get a new car. He walked out with a new car, top line. His wife walked out with a new car. This is because of that positive thinking, manifesting, and taking advantage of a failure into an opportunity. I know many people who have gotten new cars because they were able to take advantage of what's going on in the community.
All right. Okay, well, thank you. Good discussion, Zelda. We're going to have to move because it is 7:20, 7:19. I think that was great discussion. And, we are very stressed. A lot of youth are depressed and isolated based on COVID-19. A lot of adults are. So I want to thank you for those great presentations. We want to keep this thing moving. We want to bring in a testimony from one of our past 100 Black men presidents, Charles Lathan. Are you there, Charles? There he is.
I am, Walton. Good evening. And I'm going to be brief here, but I'm going to be trying to thorough as I possibly can. I got to tell you, when I got this Mimi RX, the very first thing I did was go ahead and download the app from the App Store, all right, the Mimi RX app. I first went and registered at the 100 Black Men site. And the next thing I did was to download the iHealth app, Then I added my devices. I went in and I added my blood pressure monitor. Now, all these are wireless, and they're just as easy as adding a Bluetooth. Go into your settings, just like you add one of those Bluetooth speakers. That's how easy adding these devices are. And then once I added that, then I got my pulsometer to measure my oxygen level, and you load it into your smart device as well. You can also load your thermometer into your smart device as well. And my scale. I think somebody showed a scale earlier. Also, I have a glucose monitor. Now, I personally don't have diabetes, but my wife does. And so she's been using this monitor, and I've gotten her on the Mimi RX and iHealth, and she's able to monitor her blood level, glucose level, and have a record of that to take in to her doctor, same as I do now. When I go in to see my doctor, I have all these records for them. And then once you have downloaded the Mimi RX app and the iHealth app, the other thing you're going to have to do is go to your profile on your Mimi RX, profile, then go down to the third party data. And then you can, right then you will click on that. Then you click on the iHealth. So now you married iHealth and Mimi RX, so you can share data with that. Now, I went a step further once I contacted my doctor, because I wanted to get him, my physician, I wanted to get him involved with what we're talking about doing. And so what he encouraged me to do was to download the My Chart app from UMMC, University of Mississippi Medical Center. Now this is where I go. Now in my Chart app here, I got my care team. All my doctors were listed there. I got my activities, my test results, my messages, my appointments, COVID-19, my medicines, the to-do list, my documents, health summary. As a matter of fact, billing, I can pay my bills on here. And I can share, and I can look and see if I owe them anything too. And I can share my information with anybody I want. Let me just give you quickly here about the test results on how helpful that is to me.
Sure.
For example, I go in here and I say my lipid panel. Now, most times the doctor, you go to the doctor and say, we're gonna take some tests on your lipid panel. Hell, I didn't know what lipid panels were until I started figuring it out. And it tells me in here that on my lipid panel, my triglycerides, and not only that, it tells me what's normal, what's borderline, what's high, and what's very high. So I can understand the numbers that they're throwing at me. It tells me about my cholesterol and all that. And I can go on at AST. You know, I have my AST. It tells me what's good. It gives me my results. It tells me what's bad, what's good, and what I need to improve on. And I can even ask my doctor questions about some of my tests. So what I want to say in conclusion is, because I'm so happy about this program that I'm keeping up with what's going on. I can sit here and talk to y'all all night about it, but we don't have all night. I only got a few more minutes. I will say that knowing your numbers, knowing your numbers or knowing my numbers helped me to help my doctor to help keep me healthy. And I think that's what it'll do for anybody out there. And I'm gonna say one thing before I leave. I'm a 67-year-old recovering computer phobic, okay? A recovering computer phobic. That means I'm scared of computers. But I was able to go into this thing, take my time, figure it out, create an account. I suggest that you use the same password on every one of them. Otherwise, you be like me, don't know what the passwords are. But get it. I encourage you and everyone who's listening, the sound of my voice, figure out what's going on with yourself. And that way, when you go to the doctor, you don't try to figure out what's going on. You have an idea of what's going on.
Okay. All right. Thank you, Charles. That was an awesome testimony. We're going to come back to, I think our facilitator is going to show, he's going to show the website. And why don't you scroll down, facilitator, so we can see what's on the Healthcare 2.0 with the 100 Black Men of America. Thank you for doing that. Keep going down. So listeners out there, this is the website you would go to. That's 100, the website. And you're going to click on there and you go down and scroll down. You'll be able to see the initiative you can enroll on this website. And that's Healthcare 2.0. And he's going to click on there, if you can, facilitator. There's MimiRx, which is the intuitive persistent monitoring software. It'll allow you to enroll. I'm not sure if there's a delay there, but that's where he would click to enroll on the website, 100blackmen.org. That would allow you to enroll, but maybe there's the delay. But that's how you would enroll through the 100 Black Men website. And Charles gave us a good overview of the devices. We're recommending that with this initiative, you get a minimum, you get the, if you can see this, you get the contactless thermometer, which monitors your temperature. You get the pulse ox, as Dr. Danner indicated, for your saturation and your lung health. And then worst case, worst case, get one of these blood cuffs. I'm very sensitive about my blood pressure. And this is critical to make sure that you utilize these devices. All right, so it's not, let's just close it out, facilitator. We got a couple questions here. Dr. Danner, if you can bring Dr. Danner back in and maybe the panel, the wide shot facilitator. If you can bring back Dr. Danner. There you go. Dr. Danner, we have a question here on Facebook. How often should I monitor my health with these devices? Charles gave a great presentation. How often should I monitor myself, and should I have a diary?
That's a great question. And This is a personal health diary. This should be done on a daily basis. When you start your day, you should start off by measuring your own vitals. And if you have anything that's abnormal, if you have a pain, your temperature, you feel warm, you should recheck it as many times during the day and record it to create this continuous or persistent health record. This is what persistent monitoring is about. It starts off daily and it goes from there, but you should check it with frequency. But start by measuring your baseline. Know what your baseline numbers are. And then when there's a change or a deviation, you know that there's something different or something abnormal that you can talk to your doctor or healthcare provider about.
And Mr. Campbell, there's another question for you with MimiRx. It says here, is this something that doctors endorse, and how do they play into this persistent monitoring?
Great question. The doctor probably has about as much incentive as the patient. First of all, the doctor is going to get more information. You heard from the testimony that that information that's persistent presents baselines, and that's really what the 21st century cures is about. It's about personalized medicine. Your genomics, your numbers, and the like. The other incentive, the biggest incentive for the providers, beyond getting their patients within the confines of better data and better information, is that every single thing that you saw here has a billing code for which the doctor may or may not currently be billing for. So when the doctor onboards MimiRx, as an example, they can bill $21 for that patient, and as that is structured, that $21 is the gift that keeps on giving, because if they use the system on MimiRx for telehealth, assuming they don't have an infrastructure. Now, with COVID, the rules are relaxed for telehealth. You could do it through a phone, but come January 1st, you've got to have a HIPAA or security compliant, healthcare compliant set of capabilities. This already is that. So now that $21 goes to an additional $120. And if that patient is home and doing that doctor's visit once a month, then that is once a month at $120, where you now, particularly for elderly patients, you're able to keep them safer. They're not having to come into the office and expose themselves to COVID. You're saving on travel and transportation time. And there's just probably 80 or so diagnostics codes that could not be implemented because of the lockdown. In many states, you guys are in Maryland, you know that they just cut back to the toughest sanctions as it relates to COVID just today. And that's going to be many, many more states, and it's no telling what's going to happen once the administration changes and we still seeing these high death rates and high density rates for infection. So the doctors are, there's just money on the table for the doctors. And the interesting thing about that is it drives the overall cost of healthcare down, because now these patients aren't presenting in the emergency room. Now they're not getting on a respirator because they, as Dr. Danner talked about, they're getting early involvement with the clinical environments. And as Zelda talked about, these are also incorporate things like the social determinants of health, where those community health workers now are joining the team, and they too get a view of the patient and the volleying of the information back to the patient and back to the doctor. That is what creates a holistic healthcare system. It exists in many other countries, and we're now trying to empower the United States without socialized medicine, and this is a leave no person behind. We will give the population 5G devices for 5G healthcare.
Excellent.
That's amazing. We also have a question from Mark Tillman, and any of you guys can take this. Can you live long with high blood pressure? I'm not sure. Is that Zelda or is that Dr. Danner? That's from Mark Tillman. Can you live long with high blood pressure? I think I know the answer, but who wants to take that?
Can you live long? You can live long with anything, but are you at increased risk the whole time? People who have high blood pressure have a higher chance of having a stroke or a heart attack or basically kidney failure. And if you develop a complication to untreated hypertension, we call it the silent killer for a reason. So you don't want to play that kind of Russian roulette with your life. So that's why it's so important to monitor. Zelda?
Yeah,
Zelda,
I
you have-
wanted to add to that because I've had several clients who had horrible high risk ranges of blood pressure for years. And I wondered, my goodness, how are they still alive? But once you get your medicine, I'm an integrative practitioner. I believe in the medicine, conventional medication. But along with that, when you start to implement some of the natural products that you can do, like beets for nitric oxide, celery, turmeric, green tea, and extra virgin olive oil, and quite a few other things. And the number one is magnesium. You can have had very high risk hypertension numbers. And then when you add a lot of the natural medicines, it does kind of reverse what was really leading you towards cardiovascular disease, heart failure, etc. You can begin to reverse that, and it can happen quickly. Within 3 months, I've seen it happen. I had a person who was 180 consistently, sometimes 200, over 120. He came into normalization within 3 weeks using natural medicine.
Very good. So we're at the bottom of the hour. We have one last question, and I'm not sure who wants to handle that. It's something to do with vitamin D. Maybe Dr. Danner said something about vitamin. I hear a lot about vitamin D. Is that the only vitamin I should take on a daily basis to combat coronavirus?
I think that is an excellent question.
Okay.
I think of all the vitamins you can take, vitamin D is probably the most important as it relates to the immune system, but multivitamins and mineral supplements in general are important for the overall body health or cellular health. Vitamin D is a natural occurring hormone in the body. It's converted in the skin in sunlight during, basically March to roughly October. And it actually affects the immune system. It's something called local or paracrine conversion. When your vitamin D is greater than 30, it helps the body go through the normal stages of immunity, which include not only the initial, what's called the pro-inflammatory response, but then the body adjusts, or we call the adaptive response. After the body is adjusted to whatever the infection or contagion is, it has to be shut off. Vitamin D levels that are greater than 30, greater than 40, actually activate a feedback loop. It's called the 27-hydroxylase to turn off the bioactive or the active vitamin D to start shutting down the immune system. When people cannot do that effectively, namely people who have lower vitamin D levels, which Black people or people who have darker pigmented skin are at increased risk, increased prevalence, they have a higher incidence of things called autoimmune disease where the body attacks itself. So vitamin D, actually, when you have an infection, it's what, after the infection is cleared, allows the body to turn it off if it's high or adequate. And if it isn't, then that same activated system can start attacking the normal host or the normal person. And a lot of time it manifests as this condition you've seen on the news called cytokine storm. These cytokines get released and the person has a bad outcome, or they have this ongoing inflammatory response. So people who have low vitamin D levels have increased risk for bad outcomes with cancer, infections, such as bacterial or viral infections, even depression, even mood. This is why people move from the Northeast down to Florida on a regular basis to get to the sun. And this is how doctors treat this on a regular basis. But it's because of vitamin D. You can take it via supplementation. With the amount in the diet, the milk and bread and fish, other things are too low.
Your sound for some reason. Go ahead.
Okay, but
There you go.
It's very important that you supplement, get your levels up to normal, and not just take vitamin D. Get your doctor to measure your levels, make sure they're greater than 30. And if you're a purist, normal is greater than 40 to 50. There's a therapeutic level up to 150. A lot of people say it's unsafe, but that's totally untrue. And really, it takes a huge amount of vitamin D to even come close. So taking your vitamin D, but take it in addition to your multivitamin, in addition to zinc, in addition to turmeric, is your best outcome, a best combination, particularly if you're at risk or you actually have this coronavirus or other related type respiratory viral infections.
Yeah, I would add to that, please, because D is excellent, Dr. Danner. I'm agreeing with you. There have been some studies that have found some other vitamins that have led to effective treatment of COVID, and that's C, believe it or not, is the big one coming up. Your electrolytes, so magnesium, they've found that a lot of the patients that have come in need selenium. So there's a water that includes supplemented selenium called BAI, B-A-I. So that's a good thing. It's inexpensive to do. Now, here's what the Z protocol is with the Natural Hypertension Institute. It is, of course, D, B complex, B12, B6, especially if you have white spots, multiple moles on the face, and that helps for your emotions, foggy brain, and your mood. Folic acid has great benefits. And then, of course, I like, magnesium. And there are particular types of magnesium. I like magnesium glycinate. And I also think you should be adding quercetin. That's another one that's been found. And then Dr. Danner did talk about zinc and elderberry. Those are the ones that I like a lot. There are some other modalities that complement those vitamins as well. And we can talk about that in another way.
All right. So this has been very expansive. I think facilitator is going to go back to the website. I think you got it functional now, and we're going to show someone how to be enrolled facilitator. If you can bring up that website again. Yep, let's go there and let's click on the enrollment there. Click on that personal enrollment. And again, there you go. This is the first step. So you go to 100blackmen.org, you click on Healthcare 2.0, and you see how user-friendly this is to sign into MimiRx. Get yourself in the database and start measuring yourself. Mr. Campbell, did you have any feedback on this as we look at this before we close out?
There's no way I have any feedback with Dr. Danner on. The 100 Black men have actually stepped up. And when we started this conversation, that was when we first heard of the critical nature of the health disparities with African American people in particular, and all others in general. So from our vantage point, we're just so proud to be associated with Morehouse School of Medicine, with the National Institute on Primary Care, and as well with the 100 Black men. This is hopefully going to be the gift that keeps on giving. When you load on this, you own your data. It is private to you. You don't have to share it. You can pull it from any place within the healthcare continuum, your eye doctor, your podiatrist, and even put your supplements in. And at the end of the day, if you're a child born today, and you put that child on MimiRx, they will have this licensure for 25 years. So 25 years at tracking your medication, your immunization, and by all means, knowing your numbers is what we're trying to provide as a gift to humanity. I thank you all for all of your participation, and I'm so proud to be associated with this project. I don't know what to do.
It's outstanding. And you see, viewers, it's very intuitive. We have the scans there. You have your tablets, your laptop. It's a very, very great intuitive software. It's very easy, larger fonts. And as Mr. Campbell said, you have this for a lifetime. So we're going to close this out.
And Walter, before we close out, I just want to tell everybody, just if you go to the 100blackmen.org /healthcare2-0, you will come to the landing page. Please review the landing page. There's a lot of information. Click enroll today. And when you come to this page and scroll down, this QR code, if you basically take your camera and focus it at this code, you could download the app onto your smartphone from this QR code and become a part of this Healthcare 2.0 initiative. Please join us and help us to hit the reset button on the health of Black people in America. So we just thank you and thank Radio 1 and thank our sponsors, Pfizer, and want to thank the National COVID-19 Resiliency Network, as well as the National Council on Aging and all our many health partners. But thank you, Walter. And
You're welcome. And we're going to, I think to facilitate this one last question. Where is the question? I don't see the question. I'm not sure what you mean by that, Administrator, but we're going to close it out. I think we're past the hour at 7:41. Let's, to Dr. Danner's perspective, and Dr. Danner, thank you for your leadership, because, you're pretty much the pioneer. I work with you closely. So thank you for your leadership in rolling out this very, very important initiative that it's a call to action, Dr. Danner. Wouldn't you agree? It's a call to action that we can't play with this. This is something that we get busy in life, but this could be catastrophic. I repeat, catastrophic in nature. So why don't we just close it out? Zelda, are you still there?
Yeah.
What's your final, just make it 2 minutes real quick. What's your final comments? And then we're going to close everything out. What's your final comments, Zelda?
Well, my final comments are you need to understand food as medicine. Music as medicine is very effective in lowering the blood pressure and managing your emotions. I think also you need to take a look at some of the modalities that are available to you that help with managing your stress and getting your blood pressure down beautifully. You'll be surprised. I would recommend that people take a look at the 100 Black Men website. There's a comprehensive webinar that we did in May that goes over a very comprehensive list of things you can do to manage both your emotions and also decrease your blood pressure.
All right, thank you. I think Dr. Alexander's back. It's Dr. Alexander. I want to get his final comments. Oh, there he is. Thank you, Doctor.
All right, thank you, comrades. You all did a masterful job, and I would want the audience to know, all of our chapter members to know, that this is not a one and done program. We're going to be stressing this, we're going to be emphasizing this for years to come until we get all of our members and the people in the communities that we serve to embrace Healthcare 2.0. We're going to discourage our members to even get on airplanes to travel across country if their blood pressure is too high or if their other vital signs are not functioning. As many of you may know, we are continuously counseling members. We've had to send some of our members to the emergency room because they have cardiac issues when they come to our national meetings. Do not check your blood pressure once or twice a year. That is foolishness. If you have hypertension, and most of us do, we have to regularly monitor this. So I want to thank you all. I want to thank Eagle Force, and look for announcements for upcoming webinars. We're going to be hosting a series on nutrition. We're going to have fitness challenges. We're going to have programs that impact our children, because sadly we found that adult onset hypertension and diabetes is occurring in our elementary school age children. So we have a lot of work to do, and I know the 100 is up to the task. I want to thank you all. I wish you happy and healthy holidays, and look forward to seeing and working with you in the coming year.
Outstanding. Thank you. Mr. Campbell, are you still there? You have any parting words, Mr. Campbell? I know you were thinking earlier, but what's your final segment to this whole initiative, Mr. Campbell?
The initiative is great. Thank you all. This is Veterans Day. Go Army, go Navy, beat Army.
All right, and we're going to close it out with Dr. Danner. This has been a really intuitive session. Dr. Danner, are you still there? What's your final comment, sir?
Well, first of all, I want to thank everybody once again. I think that to the audience, my final word to you is, it's so important that you take ownership of your own health, that you take advantage of the available technology and begin to daily, consistently, persistently monitor your health vitals. This is about externalization of the healthcare system. We can't let COVID-19 be the reason that we don't go to the doctor or don't take care of our health and our bodies. But ignorance and not knowing is not an excuse for breaking the law. Hosea 4:6, one of my favorite scriptures, says, "My people are destroyed for a lack of knowledge." We need to seek knowledge. And with all you're getting, it says, "Get ye understanding." It's very important that you educate yourself. Education is the key to your success, but not only just acquiring the knowledge, putting it into action. So hopefully, as Mr. Deutsch said, this is going to be a 365-day a year, multi-year endeavor, but this is about a lifetime of healthy lifestyle changes. We're going to be having initiatives such as our fitness challenge is coming in January, and our subsequent webinar, virtual town hall in early January. You'll have information, but join us. Bring in your family, bring in your friends. This is for everybody, but we are here for you, and we're going to fight our way through this COVID-19. So again, follow the guidelines, practice safe distancing, wear your mask, practice good hygiene, and do what's necessary to take care of yourself, but also the ones that you love. So I want to thank Walter. I want to also, again, just kind of, again, reiterate, thank you, Mr. Campbell, for sharing this technology with us. This is actually a set of my vitals. I know you can't see it using this Mimi RX app. It measures, continues to give you a complete scrolling health record. But these immune enhancement supplements, the big thing is there's been a lot of talk about there's not anything that we can do. We want to tell you there are things that you can do. Do the minimum and fight, fight, fight. Don't go down without a fight. And, you know, again, as far as it relates to vaccines and things like that, that's another burning question. You know, again, my recommendation is I personally will participate when the vaccine's available. There's no 100% right answer. They're getting the data. The vaccines seem promising, but it's going to take trial and error. We're going to have to learn our way through this pandemic, but we're in this together. And we want you to understand that the 100 Black men of America are here to support you and support each other through this pandemic. Thank you.
Thank you, Dr. Danner. What an outstanding job for the entire panelists on behalf of the 100 Black men of America. This is Walt Kirkland. I hope you learned something today. Again, this will be a one part of a 4-part series. We'll get more detail in the future. We had over close to 700 viewers at one time at 50 different sites. So we did have some good activity. We want to thank also Eagle Force and their support. We also want to thank NCRN, who came on earlier with the partnership with Morehouse, and Pfizer Foundation, who's doing some great things in the community. But we're excited, we're fired up, and we hope to see you soon. There'll be something coming out. Be safe, wear a mask. God bless you, and happy Thanksgiving.
Happy Thanksgiving.
All right, bye for now.
Bye-bye.